This video is an ethical and legal request for your informed consent to undergo the medical procedure called a colonoscopy. Your doctor wants you to understand why this procedure is necessary, how it will be performed, and will also explain potential risks, complications, and benefits associated with this procedure, as well as its reasonable alternatives. To better understand colonoscopy, let's first look at how the body's digestive system works. The digestive system is also known as the gastrointestinal tract, GI tract for short. The GI tract includes the mouth, throat, esophagus, stomach, small bowel, and large bowel. The lower GI tract extends from the upper portion to the lower portion of the colon that ends at the rectum or the sigmoid to the cecum. This is a colonoscope. It enables doctors to closely examine the lower GI tract lining on a video monitor. On one end is a camera that's guided with a set of hand controls. Small openings on the end allow instruments, air, and light to pass through. The scope is inserted into the rectum and guided around the curves of your bowel to the end of the colon, pausing occasionally to inflate certain areas with air for a clearer view. Colonoscopy can cause some discomfort. Prior to and during the exam, your doctor may give you intravenous medications to reduce anxiety and to provide sedation. These medications might make it difficult for you to remember the exam. Some of the risks of sedation include depression of reflexes, decreased breathing, and decreased blood pressure. Side effects and complications are rare but can occur during or after the procedure. Although the scope is well lubricated, you may feel uncomfortable when it's inserted or navigated through your intestines' curves. Gas or cramping may occur as air is used to inflate certain areas for better viewing. The most common reasons for colonoscopy include, but are not limited to, prevention of colon cancer, rectal bleeding, hidden blood in stool, bowel dysfunction, abnormalities from other GI tests, evaluation of a previously diagnosed condition, a family history of polyps or cancer. Detection and removal of polyps is the most common reason for colonoscopy. Polyps are usually harmless tissue growths, but can sometimes be precancerous. Other findings can include colitis, tumors, diverticulosis, vascular malformations, and ulcers. If you've given your prior consent, your doctor may treat any abnormalities seen during the exam. If found, polyps can be removed or a biopsy may be taken. There is no feeling inside the colon, so you won't realize this procedure is being done. Because a colonoscopy allows a doctor to see your GI tract so clearly, a determination if further tests are needed and treatment plan for your diagnosis can be developed. Colonoscopy is usually safe and associated with fairly low risk. However, you should be aware of all possibilities. Risks include pain and discomfort, a tear or perforation of the colon or rectal wall. Bleeding can occur from scope trauma, dilation, biopsy, or polyp removal. Cardiac or respiratory complications, reaction to medications, infection, irritation or phlebitis at the IV site, the possibility of missing a lesion or cancer. Other risks specific to your physical and medical condition discussed with you by your doctor. Extremely rare risks include death, brain damage, disfiguring scars, paralysis, loss of function of organ or limb. There are alternatives to a colonoscopy. They include CT scan, barium X-ray series or barium enema, blood vessel X-rays, nuclear scans, laparoscopy, open abdominal surgery. However, most doctors consider the result of a colonoscopy to be the most cost-effective diagnostic procedure with the least risk. The decision to undergo this procedure is yours and should be based on your doctor's evaluation of your particular problem as discussed with you. If you decide not to have the procedure, be aware that your doctor may not be able to properly diagnose or treat your condition, which could worsen or possibly spread. This video can be helpful in your right to informed consent of colonoscopy, but should not be considered a substitute for discussion with your doctor.